Hi everyone and welcome to the channel. My name is Dr. Marie Dona and I'm a youth and adult psychiatrist and therapist. I'm here to discuss all things mental health and wellness related. So I wanted to start off this video on this channel by giving you more information about myself and why I do what I do. So about me is I was born and raised in the East Coast, like in the New Jersey area, and my father is a physician himself. I had always been interested in becoming a doctor, but I didn't know what kind of doctor until later in my training. So it actually happened when I was in medical school and I was on my clinical rotation. So during third and fourth year of medical school, you get exposed to a lot of different fields like psychiatry, internal medicine, pediatrics, etc. But one thing that kept on happening during my rotations was that I just kept wanting to spend extra time with the patients, get to know their history, get to know their backstory. And people would say, oh, hurry up, we got to keep going, let's look at the labs, things like that. But I was just always more interested in hearing about the person as a whole. So then when I actually hit my psychiatry rotation, I was like, okay, I think that this is what really fits and aligns with what I would want to do and pursue. And that's kind of where I decided that I wanted to pursue psychiatry. And it's been something that I've been loving and enjoying doing since then. So then I went to medical school and in the Philippines, and then I did all my training in Philadelphia. I did my residency at Albert Einstein Medical Center in Philadelphia, and then I did additional subspecialty training in child and adolescent psychiatry at Thomas Jefferson University. Since then, had experience in a lot of different type of psychiatric locations. So I've worked in emergency room psychiatry, inpatient psychiatry, outpatient psychiatry, residential and partial psychiatry. And I currently have my own private practice, which is Dona Wellness Clinic, and that is physically located in Riverview, Florida. But I am licensed to see patients throughout the state of Florida, along with the states of New York, Pennsylvania, and Washington, D.C., all virtually. Right now, I am doing a private practice primarily, and while I do have a physical location in Riverview, Florida, I will say that most patients have enjoyed having a virtual location where they can touch base, regarding medicines or therapy, as it is a lot more convenient than going into the office. But I will say there are some patients who still prefer going into the office, and sometimes there are certain medications that require in-person visits. So that's why I have that location in Riverview, Florida specifically still available. I'm a psychiatrist and I am trained and an expert in prescribing psychiatric medicine. That is not my approach, and I am someone who likes to think holistically about the whole person. So behavioral interventions are something that I will always recommend first. That will typically require someone who, may be presenting with anxiety, depression, potentially engaging in therapy or another behavioral intervention first, or say it's a child who is having behavioral issues, working with someone like a therapist on pinpointing what might be contributing to those behaviors and working on them from that perspective first before considering medications. And not only those behavioral interventions like therapy, working on behavioral regulation that can be done, but also I like to take into consideration other things such as sleep and nutrition. I like to think of the human body as a whole. Like, we work on homeostasis, right? Like, we like to make sure that we are in a routine that is kind of regular to keep things steady. But say something is off, like your sleep is off, your routine is off, your nutrition is off, that is something that can definitely affect someone from a mental health perspective, like depression, anxiety, mood, behaviors, etc. So really honing in on emphasizing the basics and fundamentals of what makes a person feel good. And then ultimately, if someone is working on all those things, but they're still having a lot of trouble otherwise with managing their mental health concerns, that is when I would discuss potentially giving medications a try. So thank you for watching our channel. We will have a lot more videos regarding mental health topics from here. You can always comment and subscribe to let us know if there's additional content you would like to hear from us or see from us specifically. Hit that subscribe button and keep following us for more information and tips on all things mental health and wellness related. Thank you.